Hi, I'm Corey White, CEO and founder of Cyvatar, and I'm here with my good friend, Steve Struthers. And Steve is an industry veteran and expert in healthcare and cybersecurity. So he's going to talk to us a little bit about what's happened in the Change Healthcare breach. So, Steve, thanks so much for joining us today. How are you today?
I'm doing great, Corey. It's great to see you. Looking forward to the discussion.
So, Steve, tell me, who were the attackers and what happened? Give us an overview.
Sure, Corey. Great to be here. What happened with Change Healthcare? I mean, this type of cyber attack, it's known as a ransomware attack. Everybody's heard of them. It's essentially a type of malware that encrypts data on the systems of the victims. And then the idea is to make that data and make those systems inaccessible until the victim pays a ransom. And that's where we're at. As far as who the attackers were, there's a group called Black Cat Alpha V. They're a well-known organization out there that has been, a enemy of the state, so to speak, for many, many years. They claimed responsibility for this attack, and of course, the idea is that they're demanding money for the services to be restored. Um, and allegedly, and again, this is not confirmed by Change Healthcare, but allegedly they did pay a ransom. There were some security researchers who have already said that that is what happened. And, you know, unfortunately, this attack, just like a lot of others in the healthcare sector, it's a big reminder that there are vulnerabilities and they're still out there and there are major consequences, frankly, to cyber attacks.
So, Steve, all right, there are ransomware attacks happening every single day. Why is this Change Healthcare hack different? How does it affect me or the regular consumers? What's the impact here?
A lot of people don't realize, but the Change Healthcare platform, it provides a few different services to healthcare providers, and literally, it's one of the largest in the world. It helps providers with claims, processing, and payments. So when you go to the doctor's office, there's a good chance that your claim to your insurance company and your payment from your insurance company gets handled by Change Healthcare, not necessarily directly by your insurance company. So all of these claims, all of this processing is integrated, for the doctors to make it easier for them to manage the system. And the Change Healthcare platform, like I said, it's one of the largest in the world. And this company alone manages about 15 billion claims a year and over $1.5 trillion worth of claims.
So, does it
And
stop me from getting my healthcare, getting prescriptions? What does it stop me from getting? How does it impact me?
what it stops is it stops the providers from being paid for the services they're giving to you. And as you know, it's business. A lot of the providers get confused. They're not sure, can they provide services to you? Can they issue some prescriptions to you? Will they get reimbursed for those? So it really caused a lot of delays that affected the entire supply chain all the way down to patients. Now, hopefully, and I believe this to be true, providers are responsible enough to not put anybody's life in danger or not allow people not to get prescriptions. But the truth is, it's a massive challenge when people can't get checked into hospitals when they should, when people can't get the services that they should, and when, frankly, providers can't pay the people that are working for them that are helping patients in the hospital.
So, Steve, I've been to doctors and with my kids and everything else, and they have all the HIPAA forms. So, don't you have to be HIPAA compliant? All these healthcare providers, shouldn't that stop these ransomware attacks? Like, what? Why don't we prevent these things?
It's a really good question. And I mean, HIPAA compliance is, of course, as you know, it's about privacy of your data, and it's about, protecting your data from being shared against your will with not just, people like this group, but also with, people that make want to know about your health condition. So that's what HIPAA is. And HIPAA does have many, many provisions that are supposed to secure data. But ultimately, it's a very complex set of rules, and smaller organizations that are the victims of this, frankly, have a harder time complying with all of those requirements of HIPAA. And I believe personally, even if you complied with 100% of HIPAA, it still doesn't necessarily protect you from upstream and downstream cyber attacks like this one. So when it doesn't exactly happen to you, but it happens to somebody that you rely on for your business.
So HIPAA doesn't stop ransomware, basically. HIPAA
No,
compliance. Yeah.
absolutely not. That's
Oh,
not what it's designed to do.
okay. All right. So we're gonna still continue having a problem in the healthcare industry because even if they're HIPAA compliant, it's more about privacy versus stopping a ransomware type of attack.
Absolutely.
All right. So Alpha V, Black Cat, aren't these the same folks that did MGM and Caesars?
They sure are. Yeah, it's the same group. And they have been targeted by our law enforcement for many years, and we've had some success at shutting them down in many instances. But they certainly made a recovery here, and this is the largest attack that I'm aware of on our healthcare system in history. We were talking, disruptions that were costing the industry about $100 million per day. So if you think about this attack going on for 30 days, that's $3 billion impact.
That's crazy. Dive down into the impact. Like, why is this so impactful from a financial perspective? I know you just gave some numbers, but give a little bit more detail there. And just how big is the scope? Like, how many healthcare providers?
That's a great question, but think about the scope of the company that I just told you about. They're a service provider. I mean, how impactful would it be to shipments in the United States if UPS was shut down for a day or if Federal Express was completely shut down for a day? That's the kind of scope you need to think about this on. And essentially, some of the ways that this attack had an impact are things that we deal with every day. So patient care services, right? There's a whole range of services that Change Healthcare provides that directly affect patient care, including like clinical decision support. So those kind of systems were part of Change Healthcare. I mentioned before, claims processing, eligibility checks, just to be able to go check and see if a claim could be processed patient was admitted to the hospital. These are done through Change Healthcare in many cases. Hospital finances. So, hospitals basically receive money from these exchanges, and if they're not able to submit their claims, then the cash flow of the hospital is impacted. And a lot of times, there's things like patient billing, estimating the cost of services. Those things are all built in as well. So the hospitals have a hard time telling the patients, what fees can you expect to see? On top of that, if you have like the prolonged disruption like this one, now all of a sudden maybe hospitals can't afford to pay salaries, right? For the people that are working in the clinics, for other members of the care team, they might have to be buying equipment or other things or supplies, and all of a sudden the money's not there in the bank because the claims haven't been paid, so they have to come up with a new way to process their day-to-day business. And then obviously when there's an electronic process offline, you have to move to paper. So now you have all of the administrative costs of doing things that used to be automated manually and by hand, and then eventually having to type them all back into the system in the future. So those are just a few of the things.
That's a lot. Okay, Steve. So we talked about Change Healthcare and the hack that happened in the last few weeks here. How did it exactly happen? Does anybody know yet? Do you have any details around what caused this hack?
Well, sure, Corey. Like I said a little bit earlier, the attack seems to have been carried out by a ransomware group that's known as either Black Cat or Alpha V, ALPHV. And the outcome is that it led to some massive disruptions in the Change Healthcare's operations. And I already talked about the size of Change Healthcare. So the method was that the attackers somehow gained access to the network. Precise details on how that happened have not been publicly disclosed in any way, which is not a surprise at this point. So even though we don't really have specifics on how the attackers were able to gain access or gain the initial access to the healthcare network, Change Healthcare Network, generally Alpha V, Black Cat, they're pretty prolific ransomware gang. They have tactics that have been reported all over the internet if you search for them. And those include, gaining access via Microsoft Remote Desktop Protocol, as well as doing brute force attacks and attacks against Active Directory. So there has been some speculation that, some vulnerabilities in one of the applications that Change Healthcare used might be where that happened. And so, as you may or may not know, I know as you know, but as some of our listeners and viewers may not know, that generally points to a third-party risk. So a software that is used by the company that they rely on and depend on, there's a vulnerability there, and the organization or the group uses that to access into the larger company's network. Again, they haven't announced how this happened. I'm not claiming that I know anything about how it happened, but that's been reported so far. So, but the real fact I think that you can know is that once the attackers were inside the network in some way, they did deploy ransomware. And these kind of attacks are really damaging, right? Because they immediately render critical systems, data, and other things unavailable. And what that does is that creates major risks for patient safety and the delivery of care. So in the case of Change Healthcare, this attack disrupted those key operations, right? It forced healthcare providers, pharmacies, and all other kinds of organizations in healthcare to deploy workarounds so that they could keep providing services, which ultimately they have to be able to do. The good news, I think, is Change Healthcare did respond very quickly, and they disconnected, from what we've read, about 111 different services very rapidly to limit the damage, right? Because they're such a big company, and when we're talking numbers like trillions and billions, systems can just impact every part of the country. And so the company also brought law enforcement in right away, and also a bunch of cybersecurity firms to try to help remediate the risk. So that's where we stand.
One point that I want to double click on to make sure that everybody understands, ransomware is not just malware. People used to think that, oh, okay, well, I got ransomware on a system. It is a hack that happens first. So whether it be exploiting a vulnerability, getting access into user credentials, social engineering is a common tactic that Alpha Black Cat are using. They social engineer their way in along with an exploit or a vulnerability. So it's a whole process as opposed to just dropping ransomware on one system and then affecting a large company like Change Healthcare. So what I want our viewers to understand is that you have to have a comprehensive security program. You can't say, oh, they just need a better antivirus to block ransomware. That's not it. Again, to your point, it was
Yeah,
most likely
that's
an exploit that started. So you have to have vulnerability management, endpoint protection, security awareness, training. You have to have all these things tied in to stop this type of attack.
yeah, that's a good point. Like, this may have been malware. I mean, that's been some of the words out there. So you're right. Malware is only a mechanism that happens before the actual ransomware attack itself. Malware is a way that somebody might get in, but the other ways you described are other ways people get in. So if you do block malware, that's great. That's important. But if you don't worry about the other things, somebody's going to get into your system through one of those other vectors. Absolutely true.
So tell me more about Black Cat Alpha V. Who else have they hacked? Is anybody trying to stop these guys?
Well, yeah, I mean, obviously, millions of Americans were affected by this hack, right? Hospitals, physicians, pharmacies that can't get information and fill prescriptions, and even people looking to make their own health claims so they can get repaid haven't been able to do that. But the Black Hat ransomware gang, once they claimed responsibility for this, we all knew, hey, that's the same group that was supposedly behind the attacks on Caesars Entertainment and MGM in 2023. They also have links to a group called DarkSide. It's a ransomware group that was implicated in the Colonial Pipeline attack, another really big attack that affected critical infrastructure in the whole eastern United States.
All right, Steve, what can organizations learn from the Change Healthcare hack? I mean, there's so many healthcare organizations out there, and we know they are a target for ransomware and hacker groups. So what's to learn here?
The first thing that comes to mind for me is that, the healthcare industry in general is particularly vulnerable to these kind of cyber attacks because it's all about money, right? And personal patient information is valuable. And these organizations sometimes lack strong cybersecurity measures. And so I think the lessons that you can learn from these kind of incidents is that no one is immune, first of all, that the downstream providers really need to be as concerned about this as the upstream providers, the big companies. I think, having contingency plans, sorry, for your business are really important. So making sure that if there is a disruption, right, if there is a problem with revenue processing, that you have other ways to process things and that's been organized, including like having the financial wherewithal to continue running your business. In addition to that, the organization should have, through their business plan, they should have put aside, all the passwords, all the things that they're going to need to go to log in manually if they lose their automated logins or logins that are done through two-factor or fingerprints. So a lot of times those things are missing. And I just say in general, it's about all of the controls. I mean, we both know, Corey, Cyvatar preaches this all the time. There's a core set of basic controls that if you implement those controls like secure endpoint management, two-factor authentication, vulnerability management and patching, and then also, things like mobile security for mobile phones, you're covering a huge part of the risk. And those controls are going to stop a lot of these ransomware hacks from happening, because those ransomware hacks happen downstream from those controls, those type of controls either not being in place or being ineffective. So I would
Yeah,
just say the thing to learn is the basics, and having the right broad coverage of the basics is really important.
I agree with you. But one thing I want to educate the audience on, when you think about having backups and contingency plans, when these hackers hack into your network, in many cases, they have admin access and they're pillaging through your network before they actually encrypt systems with ransomware or do any kind of disruption of service. But what they're doing is they're finding out, okay, do you have backups? Do you have contingency plans? And if they're admin, they're disabling that. So what you have to do in your organization is you actually have to have a separate offline system that's set up for your backup using two-factor authentication. Because if you become admin, and I've seen this before, the admin password is the same thing for their backup as it is for their domain or some other critical system. And so the hackers are able to use those same credentials, disable the backups, and then disable the whole network. Because the goal for these hackers is to get paid. And if you
That's
have a backup, then that stops them from getting paid. So that also needs to be taken into consideration.
That makes a lot of sense, Corey. And I have seen, as you have, endless times when customers felt comfortable with backups, but those backups got encrypted as well. And it's just it's one of those things that we learned over time, and we try to educate customers every day on that. It's got to be offline.
Well, we take all these lessons learned from Change Healthcare and the many hacks that happen in the healthcare industry that we don't hear about. Literally, it's one happening right now, because I know of a lot of healthcare organizations. They're focusing on patient health and not focusing on cybersecurity. Unfortunately, they have to do both because they go hand in hand. You can't have patient health without having cybersecurity, because if your system's down, then your patients can't be taken care of. And we see that live with Change Healthcare. And what we have to really learn is cybersecurity has to be rather comprehensive. So just saying that we have detection and response doesn't stop a ransomware attack. Okay, I mean, that's just going to send you an alert when that happens. You actually have to have endpoint protection configured to block the execution of ransomware malware, and that's critical. Then you also need to have a 24/7 SOC monitoring that environment. You also need to have security awareness training so that the administrators that have admin access, they know what type of attacks may be levied against them. And so this is a continuous process that you have to have in place, because the new attacks using AI and using some of the latest tools your administrator, maybe in finance or maybe IT folks, maybe don't know these latest attack vectors. They still need to do security awareness training. We see this a lot where IT folks don't do the security awareness training, and they should. They absolutely should, because there's new attack vectors coming out. Then on top of that, applying patches and vulnerability management. I think people miss the fact that there were 29,000 vulnerabilities came out last year, about 80 per day come out. So if you're not continually patching, the hackers will take advantage of that. And so what Cyvatar does is we bring in comprehensive solutions to solve all of those challenges in a turnkey solution to help healthcare organizations become secure and prevent these types of attacks. Because the last thing I'll say is that these hacks are low-hanging fruit types of attacks. If you don't have those controls in place, they're going to exploit a vulnerability. They're going to take over credentials. They're going to drop ransomware. And those are all preventable hacks if you have the proper controls in place.
Yeah, and Corey, one other thing I'd add to that is I think, you know, once you have all those controls from a company like Cyvatar, you know, being able to go out there and get cyber insurance, which a lot of these companies did not have, a lot of these small providers, that's one of the biggest differentiators as well, because obviously you don't want to get hacked, you don't want your operations disrupted, but if they are disrupted and you have cyber insurance, you can still pay the bills. And on top of that, you can recover because you have the money to go in and recover your system. So I know that's another important piece.
With cyber insurance, just to talk about this, one of the offerings that we have for our customers, you don't get paid out that insurance if you aren't doing the proper controls. Okay. And you think
Right.
about it, you're like, if you get into a car accident in your car and say you don't have brakes and airbags and either the preventive controls, then you don't get insurance, right? You got to have the proper controls in place. Then you actually can get your insurance. And that's why the Cybertalk partnership with Cysurance allows us to make sure you have the controls in place. So if a breach does happen, then you're still covered.